Hi guys, hope you all are doing well. So this is the second video on antibiotics. If you have directly come to this, please go and first see the first video. I've taken it from Nelson textbook on antibiotics, and the main objective is to increase our knowledge about antibiotics so that you prescribe them right. So coming to carbapenems, as we already know that for anti-pseudomonal activity, we learned that one option was piptaz, the second option was carbapenem, and the third option was fourth and fifth generation cephalosporins. So among carbapenems, we have meropenem, imipenem, and ertapenem, but the commonly used one is meropenem only because we see that with imipenem, there is more CNS irritability, so there increased risk of seizures in children. With ertapenem, we see that though the T half is much more, so you can do less frequent dosing, that is BD dosing you can do. But the problem is that the activity against Pseudomonas is poor. So meropenams otherwise are very good group of antibiotics with very good cover of all coliform, that is gram negatives, including cefotaxime resistant extended spectrum beta lactamase producing or AMC producing strains. Pseudomonas aeruginosa के against भी activity है, and even anaerobes like Bacteroides fragilis are also covered. But still now, since we are very good in producing resistant strains, there has been reports of emergent Klebsiella pneumoniae resistant strains, that is New Delhi metallo-beta lactamases, which are spreading across the world now. Coming to macrolides, that is erythromycin, azithromycin, and clarithromycin. Among these, the commonly used one is azithromycin only. Erythromycin we don't really prefer because it has more GI side effects. When you are monitoring the drug levels of this group of antibiotics, you don't see them in the serum because this group of drug antibiotics that accumulated in the tissues instead. Azithromycin we commonly use in atypical pneumonia, so it has good activity against Haemophilus. We also use it for treating resistant enteric fever cases, so it has good activity against gram-negatives like enteric pathogens like Salmonella and Shigella. Also, it has activity against Mycobacterium. Coming to your aminoglycosides, that is amikacin, gentamicin, tobramycin, streptomycin. So when someone develops ETT-induced hepatitis, we might choose to give them streptomycin, which was earlier a part of normal regimen for Mycobacterium. As of gentamicin, tobramycin, and amikacin, we commonly use them as single daily dosing because that has been found to be effective as well as safer in children. But the issue is that you have to be always watchful for nephro and ototoxicity. These antibiotics have also been used in cystic fibrosis patients, but there you need more dose to achieve the same therapeutic serum concentrations. So inhaled tobramycin has been successfully used in children with cystic fibrosis as an adjunctive therapy of gram-negative bacillary infections, and the role of inhaled aminoglycosides in other gram-negative pneumonias has not yet been identified. Coming to fluoroquinolones, so fluoroquinolones, several cases of joint and cartilage injury have been reported in children. This is the reason that we do not prefer using fluoroquinolones till other options are not available. So you use it in situations of antibiotic resistance where no other active agent is available. Also, when only alternative parenteral therapy is there. So for GI infections, commonly IMNCI also prescribes ciprofloxacin because it has very good gram-negative activity against E. coli, Klebsiella, Enterobacter, Salmonella, Shigella, as well as Pseudomonas. But its gram-positive activity, that is Streptococcus, Staphylococcus, Pneumococcus, is poor. A newer generation cephalosporin, levofloxacin, has good activity against organisms causing respiratory tract infection, so it can be used in ASOM or community-acquired pneumonia. And you should also remember that fluoroquinolones are bitter tasting antibiotics just like penicillins. So that is all from my side as far as the spectrum of antibiotics is concerned. Just to give you a basic idea of what to prescribe, we will build on this knowledge in the subsequent videos.